Hi, good morning dear students, and today we are going to discuss about angina. तो अभी जो हमारी पढ़ाई चल रही है वो पढ़ाई is absolutely in a different way. We are not actually learning the physiology and pathology of the angina. We are primarily focused on the management of angina. Okay, so this class that currently we are conducting all the class that primary focus on the management of the disease condition. So we are going to touch upon the disease condition in like management perspectives, and also we are going to discuss the important medications that use for the management. Okay, so that is the primary objective. So at the end of the class, you should be at the position to remember at least 15 to 20 key points about the angina and anginal medications. अगर आपने ये 15-20 जो important points है वो अगर आपके दिमाग में बैठ गए तो यू आर गुड टू गो विथ रियल लाइफ प्रैक्टिस, और एंजाइना के पेशेंट को मैनेज करने में आपको बहुत ईजी रहेगा. ओके, तो आपका ऑब्जेक्टिव क्या होना चाहिए? योर ऑब्जेक्टिव शुड बी टू रिमेंबर एटलीस्ट की 15 to 20 पॉइंट्स, और जहाँ जहाँ पे जो भी इंपॉर्टेंट पॉइंट्स है उसको मैं बहुत डिटेल में एलेबरेट करके उसको एक्सप्लेन करूँगा और उसको थोड़ा सा ज़्यादा तवज्जो देंगे. ओके, सो लेट्स वी स्टार्ट विद द एंजाइना. और यही प्रोटोकॉल है. द वॉट एवर मेडिकेशंस दैट वी आर गोइंग टू डिस्कस इन द मैनेजमेंट ऑफ डिजीज कंडीशंस, वी आर गोइंग टू गिव इम्पोर्टेंस टू द मोस्ट इम्पोर्टेंट पॉइंट्स. ओके, चलो कुछ थियोरिटिकल पार्ट होगा और कुछ जो इम्पोर्टेंट है उसको हम ज़्यादा डिटेल में समझेंगे. फर्स्ट ऑफ ऑल, what is the primary objective of using the medication for the management? Our primary objective is definitely relieving the symptoms, and the most important is reduce the risk of death and myocardial infarction. Means the angina का जो progression है, that's the myocardial infarction. So our objective is to prevent the development of the disease to the further level, and also our objective to prevent the death because of the myocardial infarction or cardiovascular events, and definitely the patient can get the relief of the acute symptoms that he is currently suffering from. That's the primary objective of using the drugs. So before we start management of angina, we have to understand what are the risk factors associated with it. That means the patient is obese, smoking, diabetes, hypertension, or any other conditions that are eventually causing the cardiovascular problems. The another important thing is cardiovascular events has a three most important elements that we have to treat. The first one is the blood pressure. So the hypertension should be under control. Second is the lipid concentration should be under control. That's the management of dyslipidemia. And the low dose aspirin. Low dose aspirin is mainly act as an antiplatelet. Okay, so antihypertensive, dyslipidemia, and also the antiplatelet. These medications can give a positive outcome in the management of angina. Consider the specific treatment. If the patient is suffering from stenosis, blockage, in that situation also we have to give the special treatment for that. And if needed, we have to do the myocardial revascularization. Okay, that's called the bypass surgery or something like that. Okay, investigating the specific precipitant, specific cause of the angina, that means the exercise. Okay, for example, if the patient is normally he is comfortable, but when he is involved in any kind of exercise or any extra strain he is putting, that means the myocardial oxygen demand is increased, and that excessive myocardial oxygen demand is not going to manage by the coronary arteries to supply the oxygen. Okay, in that situation the patient can get angina. Anemia. Okay, anemia, again the another important point. Why anemia is important? Because the patient is suffering from anemia. Is the low RBC. Low RBC required more pumping for the oxygenated blood to the cellular level. That means if we are going to treat the anemia, ultimately the load on your myocardial muscles will be reduced. Another thyrotoxicosis means hyperthyroidism that also increase the metabolic requirement, and that increase the metabolic requirement increase the oxygen and nutrient supply, that ultimately increase the cardiac load. Okay, so these kind of specific causes also we have to address and we have to treat. After that, we have to plan the appropriate investigations and start doing the treatment. Okay, so these are the theory part. Anti-anginal drugs improve the balance. What is the main mechanism of the medications that we are using for the management of angina? Is the balance between myocardial oxygen supply and demand. Okay, so we have two options. Either we can improve the oxygen supply or we can reduce the demand. So these two different type of medications that we can use. Okay, improve the myocardial oxygen demand, improve the oxygen supply, vasodilatory medications. Okay, and decrease the demand, that means the myocardial suppressing medications like beta blockers, calcium channel blockers, this kind of medications. Here is nitrates. Okay, so this kind of medications that we can use for the management. So balance between myocardial oxygen supply and demand. This medication use alone or in combinations. Okay, so various medications that we can use in alone or in combinations. Okay, so first of all, we can divide the angina into two parts. One is the acute symptoms. Okay, acute symptoms. Another one is long-term preventive. Okay, so acute management, we use the short-acting nitrates. Short-acting nitrates are normally used for the acute management. What is the meaning of acute management? Acute management is nothing but the patient is suffering from the problems at this point of time and he is developing the symptoms. So we have to start giving the medication, and this medication is immediately relieving the symptoms. So short-acting nitrates. Short-acting nitrates, sublingual glyceryl trinitrate and isosorbide dinitrates. Nitrates are very important. In today's class, we are going to discuss the nitrates in detail, so you are going to get the better understanding. Okay, acute relief. Acute relief. For acute relief, short-acting nitrates are used for two unique purposes. One is the acute relief, and the second is prophylaxis before exertion. That means what? If the patient is aware he is going to develop the chest pain if he is going to climb the stairs, okay, और अभी उसको मान लीजिए कि 2 माले चल के ऊपर जाना है, 2 माले चढ़ने के लिए उसको पता ही है कि if he is going to climb the 2 stories he is going to develop the chest pain. So before he start climbing, वो चढ़ने से पहले अगर वो शॉर्ट एक्टिंग नाइट्रेट सबलिंगुअली ले लेता है तो उसकी जो कोरोनरी आर्टरी डायलेट हो जाएगी और एक्स्ट्रा जो एक्सर्शन आएगा उसके हार्ट के ऊपर उसको कंट्रोल कर लेगा. इसीलिए शॉर्ट एक्टिंग नाइट्रेट्स के दो पर्पसेस है, दो यूजेस है. द वन यूज इज दैट relieve the acute symptoms. If the patient is suffering from the angina symptoms, that is going to be treated and controlled with the use of short acting nitrates. And also if the patient is aware about he is going to develop the chest pain or anginal symptoms, he can take it as a prophylaxis before start doing those kind of activities. Okay. Additional anti-anginals, okay, depend upon the severity and coexisting conditions and limited by the adverse effects. So some medications cannot be used in the patients because of the side effects. But we start with the most important medication, that is the beta blockers. Okay. So beta blockers are considered as initial therapy recommended. That means beta blockers are considered as the first line treatment for the angina management for prophylaxis. Okay, that means the symptoms prevention. Most important first line treatment is beta blockers. Okay. If patient is unable to, two different words I am using, okay, so I am giving more stress onto this concept. if patient is not tolerating beta blockers or patient is not control symptoms only with the beta blockers, तो ये दो सिचुएशंस में या तो हम एड ऑन करना चाहते हैं तो कैल्शियम चैनल ब्लॉकर को ऐड कर सकते हैं। अगर पेशेंट टॉलरेट नहीं कर सकता है या तो कॉन्ट्राइंडिकेटेड है ड्यू टू सम अदर रीजंस, पेशेंट इज अनेबल टू टेक बीटा ब्लॉकर्स, देन वी कैन गिव द कैल्शियम चैनल ब्लॉकर्स। तो कैल्शियम चैनल ब्लॉकर के दो यूजेस है, या तो बीटा ब्लॉकर नहीं ले सकता है तो ऑल्टरनेट में दे सकते हैं, या तो बीटा ब्लॉकर अकेले से कंट्रोल नहीं होता है तो कैल्शियम चैनल ब्लॉकर को हम ऐड करते हैं। ओके, यहाँ पे कैल्शियम चैनल ब्लॉकर, व्हेन वी आर टॉकिंग अबाउट कैल्शियम चैनल ब्लॉकर्स डिवाइड इनटू टू ग्रुप्स। वन इज डाईहाइड्रोपिरिडिन वाला ग्रुप और दूसरा वेरापेमिल एंड डिल्टिएज़म वाला ग्रुप। तो वेरापेमिल एंड डिल्टिएज़म इज प्राइमरीली एक्टिंग ऑन द मायोकार्डियल मसल्स, सो एंजाइना के लिए वेरापेमिल एंड डिल्टिएज़म आर द मोस्ट इंपॉर्टेंट मेडिकेशन, नॉट द डाईहाइड्रोपिरिडिन। ओके, वो ग्रुप वाला एम्लोडिपिन फेलोडिपिन वाला ग्रुप नहीं, ये मेडिकेशंस वेरापेमिल एंड डिल्टिएज़म। अब इसमें भी आपको याद रखना है कि वेरापेमिल इज अ वेरी स्ट्रॉन्ग एक्टिंग ऑन टू मायोकार्डियल मसल्स कंपेयर टू डिल्टिएज़म। डिल्टिएज़म थोड़ा सा बैलेंस है, मतलब वो वेस्कुलर पे भी काम करता है और मायोकार्डियम पे भी काम करता है। और नेफिडिपिन वाला जो ग्रुप है डायहाइड्रोपिरिडिन वाला, वो ज़्यादातर वेस्कुलर के ऊपर काम करता है, ब्लड वेसल्स के ऊपर काम करता है। ओके, तो अगर आप कैल्शियम चैनल ब्लॉकर को ड्रॉ करेंगे तो आपके पास इस तरह से बन जाएगा। ओके, ये है पूरा वेस्कुलर, ये है पूरा मायोकार्डियल, मतलब ये वेरापेमिल है, ये नेफिडिपिन वाला ग्रुप है और ये है डिल्टिएज़म। थोड़ा सा मायोकार्डियम की तरफ ज़्यादा है झुकाव। ओके, मायोकार्डियम की तरफ ज़्यादा है पर लिटिल बिट वेस्कुलर की तरफ भी है। दैट इज़ वेरी वेरी इंपॉर्टेंट टू अंडरस्टैंड डिफरेंस बिटवीन वेरापेमिल एंड डिल्टिएज़म का यूज। दिस इज वेरी इंपॉर्टेंट कॉन्सेप्ट, वेरी वेरी इंपॉर्टेंट, वेजोस्पेस्टिक एंजाइना। अब मैंने पहले क्या बोला कि बीटा ब्लॉकर्स आर कंसिडर्ड एज अ फर्स्ट लाइन ट्रीटमेंट फॉर एंजाइना, लेकिन अगर वेजोस्पेस्टिक एंजाइना है, वेजोस्पेस्टिक एंजाइना मतलब जिसमें कोरोनरी आर्टरी इज गेटिंग स्पेजम, वहाँ पे उसमें एक स्पेजम आ जाता है और वो मान लीजिए कि स्पेजम आ जाता है कोरोनरी आर्टरी में, तो भी वो ऑक्सीजन का सप्लाई तो नहीं कर पाएगी ना। तो इस तरह से मान लीजिए कि स्पेजमेटिक सिचुएशंस आ गई तो भी ये मायोकार्डियल ऑक्सीजन नहीं पहुंच पाएगा। ये सिचुएशन में बीटा ब्लॉकर्स नहीं देना है, नहीं देना है, क्योंकि बीटा ब्लॉकर्स कैन वर्स दिस सिचुएशन। तो आपके एग्जाम में क्वेश्चन आ सकता है कि वेजोस्पेस्टिक एंजाइना विच ऑफ द फॉलोइंग मेडिकेशन शुड अवॉइड। ओके, तो बीटा ब्लॉकर्स नहीं देना है। नॉर्मल एंजाइना में बीटा ब्लॉकर्स कंसिडर एज फर्स्ट लाइन ट्रीटमेंट। यहाँ पे कैल्शियम चैनल ब्लॉकर्स प्ले इंपॉर्टेंट रोल। जो वेस्कुलर कैल्शियम चैनल ब्लॉकर्स है जैसे कि नेफिडिपिन वाला ग्रुप है, दे आर प्लेइंग वेरी इंपॉर्टेंट रोल इन वेजोस्पेस्टिक एंजाइना। दिस इज वेरी वेरी इंपॉर्टेंट टू अंडरस्टैंड। Vasospastic angina use the calcium channel blockers or long acting nitrates. Beta blockers में exacerbate symptoms, exacerbate मतलब worse करेगा। Okay, if beta blockers and these are ineffective, if these are ineffective, then we can add dihydropyridine calcium channel blockers. Okay, if still inadequate, then we can add third agent. ये थोड़ा confusion नहीं होना चाहिए, ये समझ के चलो। देखिए, सबसे पहला फर्स्ट ट्रीटमेंट है बीटा ब्लॉकर्स एंड और कैल्शियम चैनल ब्लॉकर्स एंड और फर्स्ट आता है, एंड और फर्स्ट आता है लॉन्ग एक्टिंग नाइट्रेट्स, लॉन्ग एक्टिंग नाइट्रेट्स। ओके, तो अब ये थ्री मेडिकेशन कॉम्बिनेशन हो गया। ऐसा भी हो सकता है या तो ये नहीं ले सकते हैं तो भी नाइट्रेट्स दे सकते हैं। ओके, अगर यहाँ तक नहीं चलता है देन वी कैन यूज द अदर मेडिकेशंस। ओके, अदर मेडिकेशंस में कौन कौन है? ये आइविब्रेडिन, निकोरेंडिल एंड परहेक्सेलिन। ओके, तो ये तीन मेडिकेशंस अदर एंजाइनल एंटी एंजाइनल मेडिकेशंस है, आइवेब्रेडिन, निकोरेंडिल एंड परहेक्सेलिन। अब तक आप ये समझ चुके हो कि एंजाइना में कौन कौन सी मेडिकेशंस यूज होती है। सबसे इंपॉर्टेंट, पहले एंजाइना को हम दो पार्ट में डिवाइड कर देते हैं। फर्स्ट इज कंसिडर इज एक्यूट सिम्टम्स, अभी सिम्टम्स है तो उसके लिए शॉर्ट एक्टिंग नाइट्रेट्स। The majority of the part is the symptoms prevention. Symptoms prevention, first line treatment is beta blockers and or calcium channel blockers, खास करके verapamil and diltiazem, and or nitrates and or ivermectin, nicorindil and perhexalin. Okay, so this is the ladder, this is the level that you must have to keep in mind. And also you have to remember the vasospastic angina, we must not have to give beta blockers. Beta blockers should avoid in vasospastic angina. Okay, perfect. Chalo, beta blockers reduce angina frequency, prolong exercise capacity, decrease cardiac events and mortality. So that's why beta blockers are considered as the very important substance. For heart failure patients, we can use 3 carvedilol, bisoprolol and metoprolol control release. Can be used with dihydropyridine calcium channel blockers, can be used because the dihydropyridine calcium channel blockers can cause a reflective tachycardia, and that reflective tachycardia can be controlled by the beta blockers. So this combination is a good combination. Can be used with the nitrates. Okay. If not, then the calcium channel blockers, nitrates, ivermectin, nicorindil and perhexalin. So this is the sequence we can use the medications. Beta blockers, what are the questions you have to keep in mind? The first is vasospastic angina can exacerbate, that can get worse. So beta blockers should not be given to the patients, those who have suffering from vasospastic angina. Second most important thing, beta blockers must not be withdrawn abruptly. If you are going to withdraw abruptly, means the suddenly, okay, immediately if you are going to withdraw, in that situation, the cellular upregulations has occurred, and that's upregulations can cause excessive myocardial oxygen demand, and that can cause a myocardial ischemia. Okay, so myocardial ischemia, myocardial infarction, heart failure, that kind of situations can increase the risk of infarction, sudden death. That's why if the patient is stabilized on the beta blockers, we have to taper the dose in 2 to 6 weeks. Gradually we have to decrease the dose, and then we have to wean off. We have to get out of the beta blockers. We must not have to stop the beta blocker abruptly. This is very important information that you have to keep in mind. Avoid with verapamil, because both the medications are significantly reduce the myocardial muscles, and that's why that increase the risk of bradycardia and heart block. Avoid, okay, but some patients they might need, so in that situation we can give. But whenever in your real life practice you are getting the combination of beta blockers and verapamil, always you have to incorporate in your counseling while you are taking this medication in a combination. First of all, you have to rule out the patient is really on both the medications or not. Okay, if the patient is intentionally given both the medication, you have to warn the patients or aware the patients about while you are taking this medication, you have to keep an eye on your heartbeats. If your heartbeats are significantly slowed down, immediately you can contact your doctor. So that counseling points need to be given while the patient is taking the verapamil and diltiazem combination. Verapamil and beta blocker combination. Okay, when the patient is taking diltiazem with the beta blockers, he has to exercise more carefulness, but it's not as worse as verapamil with beta blockers, because verapamil is very potent myocardial suppression compared to diltiazem. Okay, so that's why two different words used. One is avoid and one is careful. Okay. So second medication is calcium channel blocker, efficacy similar to the beta blockers. Controlled release verapamil may decrease the cardiovascular event, reinfection and death, but verapamil is not recommended in heart failure with reduced ejection fraction. Reduced ejection fraction patient, we must not have to give the verapamil. Okay, diltiazem, what are the comparative points? Is less negative ionotropic compared to verapamil, less effect on conduction, decrease means less reflex tachycardia compared to dihydropyridine. That means that is not as vasodilatory as dihydropyridine and is not as strong, reduce the conduction as the verapamil. So it's kind of middle level of medication and safe to use with nitrates. That is the diltiazem. Okay. Use with beta blockers carefully and monitor the bradycardium. Long-acting nitrates. Nitrates, when we are going to discuss the nitrate, you are going to get the better understanding. Isosorbide mononitrate is 100% bioavailable orally. That's why that's used orally. Glyceryl trinitrate doesn't have bioavailability. That's why that's used for the alternative routes like transdermal patches, sublingual, and that's for IV. Long-acting nitrates used for prevention and short-acting nitrates used for the acute management. Okay, so that's the prevention. This is very important point for nitrates. Tolerance occur with the continuous use. That's why we have to maintain the nitrate-free interval on a daily basis. When you are going to get the glyceryl trinitrate transdermal patches, those patches are 24 hours patch, but we have to keep patch on for 12 to 14 hours and 10 hours we have to maintain the nitrate free interval. Okay, so that is very important point you have to keep in mind. And same with the other antianginal medications. Okay, other medications, there are 3 medications: ivabradine, nicorindil and parhexolene. Is atenolol and amlodipine comparable? Not shown to reduce the cardiac mortality rates. Avoid with the diltiazem and verapamil because this medication is also reduce the conduction and decrease the heartbeats. Okay, so that reduce the heartbeats. That's why diltiazem verapamil, this medication need to be avoided. Use in combination nicorindil, comparable with the beta blockers, nitrates, calcium channel blocker, reduce the cardiac events in stable angina. Severe mucosal ulcer, that is the most important one-line point that you have to remember about the nicorindil. Nicorindil can cause the mucosal ulcer. Okay, and parhexolene, 2 points very important. Refractory angina, this medication is used. Other antianginal, it can be given. The metabolism of parhexolene is easily saturable, means the enzymes that involved for the metabolism of the parhexolene is easily saturated. That means the metabolic pathway is saturated. So it's after that the slow metabolism happen, and that's why that increase the plasma concentration. That's why narrow therapeutic window and 10% of the total populations, they are poor metabolizer of the parhexolene. That means in this kind of population we need a significantly low dose of parhexolene. This is a very unique information about the parhexolene, so you have to remember. So metabolism part is important for parhexolene, and mucosal ulcer is important for nicorindil, and ivabradine is heartbeats, slow down the heartbeats. That is an important point. So only one point about the critical other anti-anginal medication, if you're going to keep in mind, you will be okay with it. Okay, because the examiner is going to ask you the questions from the most important point about that medication. You as a pharmacist must have to remember, and you must have to understand that concept. Okay, let's we jump into the most commonly used medication, nitrates. So there are three different nitrates. One is glyceryl trinitrate, isosorbide dinitrate, and isosorbide mononitrate. Mono, di, and tri. Okay. So you can remember like this. You can remember in this way. Glyceryl trinitrate is not suitable for oral. This is 100% suitable for oral. This is middle. Okay, this is middle. Dinitrates is midway. Okay. Second important thing is exogenous nitric oxide. That means nitrates has a significant effect on the vasodilatory effect. Okay, vasodilatory effect. Primarily that dilate the venous. That means veins को dilate करता है. उसका मतलब ये हुआ कि capacitance, मतलब veins are going to be dilated, so the fluid are going to accumulate in the peripheral system, and that's why the preload is going to be reduced. Preload is reduced. That means the less amount of fluid come to the heart, and that's why the heart required less energy for pumping. That is the one point. And the second is dilation of the veins, and that improve the blood supplies to the myocardial muscles. Okay, so these are the two primary objective of the nitrates. Reduce venous return. That means the fluid that is returning back to the heart is going to be reduced. That means that is going to be accumulate in the veins, because earlier the veins size like this, so that has a capacity to holding the 2 liters. Now that become the bigger, and that has a capacity to holding the 3 liters fluid in a peripheral system. So 1 liter is going to get less fluid, 1 liter less fluid reach to the heart, and that decrease the heart strain, and that's called the reduce the preload to the heart. This lower the myocardial oxygen demand. So these are the keywords. Once you understand the concepts, you just have to go through it, and within the 5-10 minutes you are going to recollect everything. Precautions need to be taken if the patient is hypovolemic, already volume is low, dehydrated patient. In that situation, we should not have to use this medication. This increase the intracranial pressure, because already vasodilatory medications that can cause this kind of problems. This is very, very important point. Very important point. Okay, concurrent use of phosphodiesterase inhibitors 5. Phosphodiesterase inhibitors, these medications has two main purposes. One is this sildenafil. What is sildenafil? Sildenafil is considered as Viagra. Okay, so erectile dysfunctioning, this medication is used. What is erectile dysfunctioning? Erectile dysfunctioning is nothing but the blood vessels is not fully dilated in the penis, and that's why if we are giving this medication, that can cause a vasodilation, and the more blood is going to hold in penis. Is the similar medication, the sildenafil kind of medications that use for the pulmonary hypertension as a vasodilatory medications. Okay, so this mechanism is also mediated through the nitric oxide, and the nitrates also through the nitric oxide. So that means if the patient is taking this combination of this medication, that can cause a severe hypotension, and the patient is going to experience the severe side effects. That's why whenever patient is coming with Viagra or sildenafil kind of medications, always you have to double check. Patient should not have to take the nitrates along with these medications. Okay, this is very, very important for your exam point of view. And this is a similar kind of medication, but specifically used for pulmonary hypertension, Riociguat. Okay, now depend upon this group of medication. Okay, tadalafil, sildenafil, and avanafil. These are the three medications. Depend upon the half-life, we can recommend the period free periods. Like for example, if the patient is taking avanafil 12 hours or more than 12 hours different between the nitrates, and this medication should be okay. If the sildenafil, this is more than 24 hours, and tadalafil more than 48 hours. Okay, that means significant amount of medications has been get out from the body. In that situation, we can use the combination. So relatively less possibilities to develop the hypotension. Okay, so this is very, very important point for your exam point of view. If the significant anemia, also we have to avoid this medication. Cardiovascular contraindication. Patient is suffering from hypotension because this medication, nitrates, can cause a vasodilation and that further reduce the blood pressure. So the hypotension is getting worse. Hypertrophic obstructive cardiomyopathy. Okay, so obstruction or any kind of like a structural damage or structural change, in that situation this medication doesn't help. Okay, then cardiac tamponades, stenosis means the blockage. Cor pulmonale. What is the cor pulmonale? Cor pulmonale, to understand, like this is heart. Okay, this is the right side, this is the left side. When we are talking about the right side is receiving blood from the veins, and it's pulmonary artery. This is lungs. These lungs connected here, and from here to body, and this is connected back here. Okay, now we just focus on the right side. Okay, to understand the cor pulmonale, just focus on the right side. If patient has a problem in lungs like COPD, okay, if the patient is suffering from the lungs obstructive disorders, this disorders is exert the back pressure. That means the pulmonary artery is getting more pressure. So these kind of patients are developing the pulmonary hypertension. This is the one point. That means this pulmonary hypertension is required. If the pulmonary artery is getting narrowed down, that required more pressure on the right ventricles to exert the fluid to come out from the right ventricle to the pulmonary artery. That means the right ventricle is getting, over the period of time, is getting the hypertrophied and is getting unable to pump. That is called the cor pulmonale. Okay, right heart, specifically ventricular failure. Okay, in this situation what happened, the pressure is start building up here. Okay, that means the patient is not able to receive, the right ventricle is not able to receive the more fluid. That means right atrium is not able to receive the more fluid. That means the venous is start getting accumulated. Okay, and that's why the patient is developing the pedal edema, liver also is getting hepatomegaly, jugular vein distension. All these kind of symptoms are associated with the right ventricular failure. In that situation, if we are going to give the nitrates and the veins are going to further getting dilated, that is causing the more problem. Okay, so cor pulmonale is relevant to the lungs related right ventricular disorder. Okay, perfect. Next point is nitrates is considered safe during the pregnancy and breastfeeding. It shouldn't be any problem. Okay, that nitrates can cause a vasodilation, and due to that headache, blood pressure is changed, vasodilation, and the headache is the most common side effect associated with nitrates. Okay, flushing, why? Because the vasodilation, Palpitation, vasodilation can cause heart to reflect, and that's called the palpitation. If the patient is going to change the position, orthostatic hypotension is also possible. Fainting means the blackouts and increase the risk of fall. Peripheral edema because of the vascular dilation. So all these symptoms are associated with the vasodilatory effect. The rare side effects is contact dermatitis and rebound angina because the blood vessels are not responding to the nitrates. Okay, compare 3 different type of nitrates based upon these 4 different points. One is oral bioavailability, second is formulations, route of administration, and duration of action. Okay, so this difference guide the selection of the medication for the appropriate use. Short-acting nitrates, what are the 2 different user cases? One is the acute angina attack. When the patient is experiencing the angina attack, at this point of time, we can give the short-acting nitrates, or we can give before exercise. Okay, or prophylaxis before exertion. Okay, तो ये 2 यूजर केस है शॉर्ट एक्टिंग नाइट्रेट्स के. उसके डोजेस फॉर्म्स देखिए. सबल्यूंगल ग्लिसराइल ट्राइनाइट्रेट, sublingual glyceryl trinitrate, and sublingual isosorbide dinitrates. Okay, these 2 trinitrates and dinitrates. Dinitrates is the middle. Trinitrates is not orally available at all. So sublingual glyceryl trinitrate is available in 2 different formulations. One is in spray, and other one is the sublingual tablet. Okay, sublingual spray and sublingual tablets. So depend upon the use, we can select the different doses form. Long acting is used for the chronic angina prevention. So now you are clear about nitrates has a 2 different user case. One is acute and the other one is prophylaxis, means the prevention of the angina symptoms. Okay, 3 different type of nitrates: glyceryl trinitrate, isosorbide dinitrate, and isosorbide mononitrates. Okay, now in a long acting we use the isosorbide mononitrate tablets or glyceryl trinitrate transdermal patches. Okay, and also we can use the IV glyceryl trinitrate. If you are going to look carefully, glyceryl trinitrate has a 3 different dosage forms. One is IV, other one is transdermal patches, and third is sublingual tablet and spray. Okay, isosorbide mononitrate has a 1 tablet form, and a dinitrate has a sublingual and conventional tablet, both forms. Okay, IV dosage form is used for acute myocardial infarction management, heart failure, persistent angina, unstable angina, and acute pulmonary edema. Okay, so these are the different uses of the glyceryl trinitrate as a vasodilatory substance. Now, let's compare glyceryl trinitrate first. Oral bioavailability. We have 4 different points to compare different kind of nitrates. Oral bioavailability is very poor. Route and dosage forms: sublingual. Sublingual may be 2 tablets and spray, patches, and IV infusion. Onset sublingual is less than 5 minutes. That means the acute angina का attack अभी हुआ, आप sublingual ही रखोगे तो immediately you can start getting benefits, and the duration of action is less than 1 hour. So by the time you can reach to the emergency services of the hospitals. Okay, so sublingual का use है आपको immediate symptoms से relieve करके आपको जो emergency care points है वहाँ तक पहुँचाना. Transdermal patches 30 to 60 minutes onsets and depend on the applications. जब तक आप रखोगे तब तक आपको benefits मिलेंगे. IV infusion that take less than 10 minutes and depend on the infusion time. Okay, isosorbide dinitrate bioavailability is 25 to 20 to 25%. Sublingual tablets that's required less than 10 minutes in 1 to 2 hours. Okay, isosorbide mononitrate, 100% oral bioavailability, control release tablet, that's required 1 to 2 hours and is the prolonged action. Okay, counseling advice, dizziness on standing में occur. क्यों? Because of the vasodilation and that can cause the postural hypotension. So get up slowly. जब भी आप पोजीशन चेंज करते हो तो पोस्टल हाइपोटेंशन की काउंसलिंग पॉइंट्स आर वेरी वेरी इंपॉर्टेंट विद द फार्मासिस्ट पॉइंट ऑफ व्यू. Why that is important? Because most of the time the patients, those who are taking this kind of medications, they have an increased risk of fall and the pharmacist has a primary responsibility to reduce the fall risk. Okay, गिरने का रिस्क हमें कम करना है. अगर पेशेंट गिरेगा तो क्या होगा? फ्रैक्चर होगा, तो और गवर्नमेंट को और बर्डन होगा. दैट्स वाई द फार्मासिस्ट इज गेटिंग द मैक्सिमम क्वेश्चंस रिलेटेड टू पोस्टल हाइपोटेंशन. क्योंकि वो प्रिवेंटेबल है इसीलिए. प्रैक्टिस पॉइंट्स, टॉलरेंस डेवलप्ड, सो नाइट्रेट फ्री इंटरवल नीड टू मेंटेन. उसका मतलब ये हुआ कि जब पैच ले रहा है तो पैचिस इज फॉर 24 आवर्स. ओके, तो 24 आवर्स अगर आपने एक बार लगा दिया तो दैट्स इज गोइंग टू रिलीज द मेडिकेशन फॉर 24 आवर्स. If the continuously nitrate exposed होगा, that means the blood vessels are not going to give response to the nitrates. That's why these patches need to put on 12 to 14 hours and at least 12 to 14 hours need to maintain nitrate free interval. 10 to 12 hours need to maintain nitrate free interval on a daily basis. अब आपका क्वेश्चन होगा कि अगर नाइट्रेट फ्री इंटरवल में, फॉर एग्जांपल मान लीजिए कि पेशेंट हैज़ पुट द पैचेस ऑन एट द नाइट टाइम, रात को 10 बजे सोने से पहले 9 बजे लगा दिया, दूसरे दिन सुबह को 9 बजे उसने निकाल दिया. अब सुबह के 9 बजे से लेकर रात के 9 बजे तक within these 12 hours if the patient is experience any kind of symptoms, तो वो क्या कर सकता है? तो वो सबलिंगुअल नाइट्रेट्स ले सकता है उस टाइम पे. ओके, सो दिस इज द मोस्ट इंपॉर्टेंट काउंसलिंग पॉइंट्स यू मस्ट हैव टू इनकॉर्पोरेट व्हाइल द पेशेंट इज टेकिंग द नाइट्रेट पैचेस, ग्लिसराइल ट्राइनाइट्रेट के पैचेस जब ले रहा है तब. ओके, तो नाइट्रेट के लिए एक ये कंपैरेटिव टेबल्स और ये नाइट्रेट फ्री इंटरवल्स, ये इसमें से आपको एग्जाम में क्वेश्चंस आ सकते हैं. ओके, ये 3 मेडिकेशंस के 3 की पॉइंट्स आप ऑलरेडी समझ चुके हो. आइवेब्रेडिन वी हैव डिस्कस्ड इन हार्ट फेलियर, बट अगर आप यहाँ पे देखोगे तो दिस इज रिड्यूस द करंट इन एस नोड. उसका मतलब ये हुआ कि वो हार्ट बीट को रिड्यूस करता है. दैट मीन्स अरिथमिया के पेशेंट या तो एट्रियल फ्लटर, एट्रियल फिब्रिलेशन, या तो अरिथमिया वाला पेशेंट है या तो जिसके हार्ट बीट्स कम है, उसमें नहीं दे सकते हैं. दैट इज अ वेरी इंपॉर्टेंट पॉइंट. सो प्राइमरी कंडीशन फॉर गिविंग द आइवेब्रेडिन इज द हार्ट बीट शुड बी नॉर्मल. ओके, स्टेबल एंजाइना विथ नॉर्मल साइनस रिदम. हार्ट फेलियर में दे सकते हैं पर हार्ट बीट शुड बी मोर देन 77 एज ए adjunct to the other therapy. It's not used as a monotherapy. Okay, वो दूसरे के साथ में सपोर्ट में दे सकते हैं. That is not a monotherapy use medication. Take with food. Avoid grapefruit juice. Avoid grapefruit juice because the ivermectin and the grapefruit components are going to compete for the metabolism. If we are taking the large amount of grapefruit juice, that is prevent the metabolism of ivermectin and that can increase the plasma concentration and increase the risk of toxicity. Inform your doctor you are taking these medications. This is very important side effect that you have to keep in mind. Okay, bright spot, blurred vision and bright spot in changing lights. Okay, so eye related side effects are the important part that you have to learn about ivermectin, that decrease the heartbeat. That is another important point. And the grapefruit juice, this is the third point that you have to add about the ivermectin. this is self-explanatory. Monitor the atrial flutter because this is the arrhythmia. Irregular pulses also stop treatment if the heartbeat is less than 50. Reserved for the patients intolerant to the beta blockers or calcium channel blockers. This is not considered as a first line treatment. Okay, that's medication is used as a adjunct therapy. No evidence of improved benefit than the other medications. Use in heart failure, already we have discussed this part. When we are talking about nicorandil is venous and artery dilation. That means preload and afterload reduction. Nitrate moiety and potassium channel activation. That's why the vascular smooth muscles dilation is the main part. Myocardial oxygen balance. That's improve the vasodilation, so increase the supply. And also both the blood vessels are going to dilated. That means that increase the capacity of the holding fluid, so the less amount of fluid reach to the heart for pumping, and that also decrease the myocardial oxygen demand. Okay, stable angina के लिए, because the dizziness, if the patient is experienced dizziness, avoid the driving and operating machinery. Ulcer, mucosal ulcer. Okay, mucosal ulcer is the most important side effect associated with nicorandil. So when the patient is taking this kind of medications, always we have to counsel about the ulcer. And if you are getting the questions, you should have to aware about it. Okay. Perhexylene exit mechanism is uncleared. That change the metabolism. Okay, कार्निटाइन के ऊपर फोकस करता है, improve the myocardial oxygen demand, utilization, oxygen utilization को improve करता है. Okay, and regular blood test is required for what? TDM, therapeutic drug monitoring. Two important side effects we have to understand. One is neurological side effects and other one is hepatic side effects. Okay, when the hepatic side effects, pin and needles are considered as the neurological side effects. Weight loss, weakness, these kind of side effects are the overall, may cause the dizziness. जब भी डिजीनेस आता है तो ड्राइविंग एंड ऑपरेटिंग मशीनरी का क्वेश्चन तो सबको देना ही है. लिवर फंक्शन एट बेस लाइन मंथली चेक करते रहना है. ओके, एंड द मोस्ट इंपॉर्टेंट पार्ट ऑफ परहेक्सिलिन इज मेटाबोलाइजर. जो 10% ऑफ द पॉपुलेशन आर द स्लो मेटाबोलाइजर. ओके, एंड इजीली मेटाबॉलिक पाथवे उसका सेचुरेट हो जाता है. दैट्स वाई दैट कैन कॉज द प्रॉब्लम्स. इसीलिए उसका थेरेप्यूटिक ड्रग मॉनिटरिंग करना जरूरी है, लिवर फंक्शन को टेस्ट करना जरूरी है. ओके, टेस्ट द वेट, ब्लड ग्लूकोज, हेपेटिक टॉक्सिसिटी एंड पेरिफेरल न्यूरोपैथी. पेरिफेरल न्यूरोपैथी का सिम्टम्स किस तरह से आप अंडरस्टैंड करोगे? pins and needles, numbness in finger and toes. Okay, that is the symptoms of peripheral neuropathy. Okay, so that was a very interesting points about angina. At the end of the class, if you are going to remember 10-15 points, those are really crucial and important. ऐसा मत सोचो कि आपको एंजाइना में एक्सपर्ट हो जाना है, पर एट द एंड ऑफ द क्लास, आफ्टर स्पेंडिंग हाफ एन आवर 45 मिनट्स, इफ यू आर गोइंग टू एक्सट्रैक्ट आउट द मोस्ट इंपॉर्टेंट 15-20 कॉन्सेप्ट्स, दैट विल बी perfectly fine. Okay, as you are going to learn multiple times, you are going to become more comfortable with the concepts, and also you are going to combine the two different medications and two different conditions. Okay, so in next class we are going to discuss about the questions and answers related to this topic. Okay, thank you very much for joining today's class and have a great time. Bye bye, take care.